You talked a little bit about the data, and obviously at Exactus, that's one of the things that we think absolutely needs to be captured in a systematic and high quality way in order to be able to do these analytics. Because without good quality data, you don't know how well you're doing. What else in the healthcare system as it sits today? What is the other sort of infrastructure that needs to be built in order to allow value-based care to become the standard? Because I
Yeah,
don't see it as an, something easy that can be implemented today. There's got to be a lot that needs to be built.
absolutely. And it is very data reliant. So one of the six elements of what's called Porter's value agenda, like how do you do value based healthcare, is
Mm.
building an enabling IT platform. And so in Quebec, we just got finally this new health data law, which is going to help, but it's not really ready. And it involves things like interoperability. One of the things that we realized, even when we asked the doctors, like, how much of this do you measure? The information was fragmented in like 12 different data silos, 12 different databases. How can you
We know.
actually consolidate? You know more than most, right? So, how do you consolidate all of that information on one single dashboard to get a whole picture view of what's happening? The the results, the health results, which is what we should be measuring, not the volume of services. If you operate on my left knee instead of my right knee where I have my torn meniscus, the doctor still gets paid, but I am now doubly, handicapped, and can't walk. Now I have worse outcomes, right?
Mhm.
And so we need to start tying reimbursement to outcomes. So the first step is measuring outcomes systematically and in a way that we can have this whole picture view of everything that matters, not just what the doctors care about, even though that's important. We want to include that, but then also add measures of quality of life in a systematic fashion. Standardize the collection of these proms as well, and then tie it to costs. So the first step is measure proms systematically, tie it to the CROMs, to the clinical reported outcomes. How do we have this whole picture view? And then also add the things that quality usually measures, which is like process metrics, like delays and, okay, fine, if you really want to measure volume, that's fine, but make sure that it's the right volume. And then how do we tie all that to costs? And so right now, I think across Canada, what's really missing is a real transparency of costs, because we want to make decisions based on not what costs less, but what is more value over time. So sometimes you think, oh, well, this diagnostic test, it's so expensive. We're going to wait till the fourth or fifth line of treatment before we actually use it. Okay, but if you just spent money and resources and the person's life on one, two, three, four, five lines of treatment that don't work, was it really a better use of your money and your resources? Or did you flush it down the toilet when you could have just spent more money on this test, but then avoided three lines of treatment that didn't work? Right. And so I think we need to tie the cost to the outcomes. First, measure outcomes in a standardized way. And I think that's what Exactus can really contribute to, good, standardized, quality data for decision making. And then how do we tie that to a much better understanding of how much things cost? So in Quebec, we have a sort of new-ish system called CPSS, or coût par parcours de soins, cost per trajectory of care. And so we're starting to understand at least episodic kind of bundles of payments, or bundles of how much things cost. We know how much radiotherapy costs in oncology. We know how much uh, transplants cost. We know how much, definitely hip and knee, we know how much that costs. That, because we've been doing that for a long time. So how do we actually understand the cost over the whole trajectory of care and then tie it to outcomes to understand, for example, in our project in colorectal, we saw that there was an opportunity to do prehab or prehabilitation, like doing therapy before your surgery will actually make sure that you get out of the hospital faster, you have less pain, you have more mobility, you're going to do better, you're going to have better outcomes. But usually the regular thing that we do is we make people do surgery, and then when they're struggling, then we tell them to go see a physiotherapist. Is it cheaper? it's what costs the most in our system is we don't have enough beds. Okay, so let's make better use of our beds, of our limited doctors and nurses, and let's maybe use other healthcare professionals more in advance of the trajectory so that we can improve outcomes. And ultimately, when you look at the real cost, it's going to cost us less. And it's the same. That's really why I got into value-based healthcare, because I knew that patients needed access to precision medicine, but our system discouraged access to precision medicine because it's always going to look expensive, even though it's higher value. And so we really need to change what we measure and why we measure it, and focus on the ultimate objective for any, especially public healthcare system, should be creating health, not just providing health services. And we do that by value-based healthcare.